There is never a dull moment. Certainly seems to be the case with Aaron Derfel from the Montreal Gazette, who seems to be all over the big stories in this province. He's on the line. Hi, Aaron. Welcome back to the show.
Good morning, Elias.
Let's start off with your latest about the Montreal General shutting down an entire floor of that building, entire wing. Why don't you tell us why this is such a big deal?
Well, it's a big deal because this is for patients who have antibiotic-resistant germs whose bodies have been, colonized by these superbugs. So the idea is to stick them in this ward. Each room is a private room, and what you do is, you prevent the spread of these pathogens, from the rest of the hospital, and that's a positive thing. But there's a shortage of staff right now that they had no choice but to close that ward. So it just underscores just the enormous pressures that the healthcare system is under, especially at the McGill University Health Centre, which manages the Montreal General.
But to me, this seems like a bit of a head scratcher because if this is dealing with superbugs, in my mind, but I could be off base, it seems like you could be opening up a can of worms to make situations all throughout the hospital worse if you don't have a wing like this, right? So it sort of seems like, okay, maybe you're saving 5 cents, but you could potentially have to pay $1. You know what I mean?
Yes. So, there was, for example, a COVID-19 outbreak in the ICU a number of weeks ago. So what they've done is they're shifting resources within the hospital. So the ER is chronically overcrowded. So what they did is they allocated some nurses to what's called like this day hospital, and that's to direct some of the ER patients who have less urgent health problems to the day hospital. But this is, robbing Peter to pay Paul, a medical version of that, because they're shifting resources from one area of the hospital to another area of the hospital. The ER is in a more desperate situation, and what they choose is the lesser of two evils. That the ER is more of a priority, and they're staffing what they call this enhanced surgical recovery unit. They want to be able to. That's another pressure that they're under. They have this huge backlog of surgeries that they have to carry out. So they want to get these patients out of the hospital as soon as possible. And so all of these pressures result in sometimes they say, look, we're just going to have to close that wing at 17 East.
So, and you mentioned the other closure of the oncology beds, right, at the oncology ward of the Royal Victoria Hospital. And I guess...
they had to do that too. It's precisely the same reason, not enough nurses. And so, the medical oncologists were scrambling to find beds, and they were sticking some of the patients, cancer patients, in the palliative care ward. This is end-of-life care. And that's, doesn't send the right signal to some of these cancer patients being transferred to palliative care. Of course, they knew that this was a stopgap measure. And but once again, this hospital or this hospital network, which is the largest in the province, is just under enormous pressure. You have this collision of two forces, an aging of the population, and you have this shortage of medical staff, especially nurses. A lot of nurses you'll recall, they quit during the pandemic. They were burnt out, and so you don't have enough staff to care for the growing needs of the population.
This the shortage of nurses and other staff, is that something that just every day it gets slightly worse, or have there been any points where the situation got worse, like any decisions where overnight it got severely worse, or is this just a slow drip that's happening here?
I think it's a slow drip that's happening, and this is a result of just poor medical planning years ago. First of all, just to put this in context, this is not unique to Quebec. Ontario is facing a lot of pressure. The UK is facing a lot of pressure. Other European countries where the populations are aging. And this is one of the fallouts of the pandemic. So, but I think that Quebec's system was in worse shape, and it's struggling a lot more. And it just I think again it underscores the poor medical planning. Mm-hmm. Previous governments. So this is not just you can't pin the blame entirely on the current CAC government. This would be the Liberals. It would be the PQ. Years ago, they should have boosted medical enrollment. They should have allowed more positions, and in fact, they were cutting and now we're reaping the bitter harvest of this, poor medical planning from years ago. And now, belatedly, they're boosting enrollment in nursing programs and in medical schools, but it takes many years to train the staff, so it could actually get worse before it gets better.
So can I ask you what's the government saying about all this and Bill 15, right, which recently came into effect? Are they making any promises that, hey, you just wait, Bill 15 is going to fix some of these things?
That's what the health minister, Christian Dubé, he's staking his future on. It's his big bet that Santé Québec, this new agency, that will have this centralizing power that somehow, they're going to recruit these top guns from the private sector. They'll be able to manage the healthcare system more efficiently. One of the reason that the nurses union has not settled yet, and this would go hand in hand with Santé Québec, is this what they're calling displacement. They want to be able to compel nurses, given the severe shortage across the country, to compel them, say in Montreal, to go from one hospital where the pressures are less intense, and have them work in another hospital, but that affects work-life balance. So that explains why right now the FIC, the Fédération Interprofessionnelle des Infirmières, it's not they haven't reached their agreement. The teachers did, but not the nurses, because it's a major bone of contention.
I think, Aaron, it's really important to make comparisons with other jurisdictions, other countries. You did a bit of that for the Montreal Gazette at the start of this week, taking a look at Quebec ER weights compared to those in England. What surprised, or what did you remark from taking a look at that?
Yeah, well, the reason that I looked into that is that in the UK, the National Health Service, it's a public healthcare system. It's a charity system there, and they're under pressure too. But there's this outrage because there, the entire ER stay is 12 hours. For 1 in 10 patients, it's 12 hours. And there's outrage when people are justifiably saying, this is unacceptable. We have to, devote more resources to this, so that, the Prime Minister is under a lot of pressure there. But when I compared it to the situation in Quebec, we have 1 in 3 patients who are staying on stretchers in the ER for, that's the average, for at least 24 hours, not 1 in 10 for 12 hours. And even the 1 in 3 for 24 hours, that's not their entire ER stay. That's just when they're on the stretcher. Because prior to that, they had been waiting in the waiting room, and then they were registered, and then they had to be seen by a doctor. So the whole stay is even longer than that. And somehow our political leaders are tolerating this, which is infinitely worse than the situation in the UK, which has elicited this outcry. This is not acceptable. We have to deal with it.
Aaron, we do have to leave it there. It's always a pleasure to catch up with you, and keep doing what you do so well over at the Montreal Gazette. Thanks so much.
My pleasure.